Welcome to First Transit's HIPAA Awareness, Privacy, and Security Training. As part of your work with First Transit to provide non-emergency medical transportation, NEMT services, you learn personal and private information about riders' health and medical conditions. That information is considered PHI, Protected Health Information. First Transit is committed to protecting our riders' information, and as our business partner, you're obligated to protect their privacy and security as well. In this training video, we'll provide an overview of HIPAA. We'll help you identify protected health information. We'll review situations in which PHI can be mishandled, and we'll give you practical ways to protect the privacy and security of confidential information. Let's start with some definitions and a review of the federal regulations that protect the privacy and security of health information. These are HIPAA, HITECH, and the final Omnibus Rule of 2013. First up is the Health Insurance Portability and Accountability Act, better known as HIPAA. HIPAA was originally passed in 1996 and has been amended several times since then. Although it's primarily known for protection of PHI, HIPAA also ensures the portability of health insurance, sets standardized coding and administrative processes for healthcare billing, and gives individuals access and control over their health information. HIPAA created a special class of information called Protected Health Information, or PHI. HIPAA imposes strict and specific restrictions on the use and disclosure of PHI. These regulations have changed dramatically since its creation in 1996. When HIPAA was first passed, medical records were primarily on paper. Your doctor took notes on paper, and your medical records were stored in physical files. Today, the electronic age has forever changed your health records. Your doctor is likely to take notes on a computer or tablet, storing your records in an electronic health record system. Because electronic information flows faster and farther than paper records ever could, new regulations have emerged to protect ePHI, Electronic Protected Health Information. The Health Information Technology for Economic and Clinical Health Act, commonly referred to as HITECH, and HIPAA's final Omnibus Rule of 2013 amended HIPAA by extending protections of privacy and security when using technology to collect, share, and store data, and expanded the obligations of every individual that comes into contact with PHI. That includes you. You may be asking how you come in contact with protected health information, and why is a transportation company worried about health information law? Well, HIPAA talks about covered entities, and they are the people you'd normally think of as having access to private medical information. Covered entities come in three categories: healthcare providers, such as doctors, hospitals, treatment centers; health plans, for example, health insurance companies, and public health plans like Medicaid and Medicare; and healthcare clearinghouses, the businesses that manage healthcare billing. However, covered entities aren't the only ones who must follow HIPAA regulations. Oftentimes, covered entities work with other companies and individuals to assist in providing services, and part of that relationship, PHI may be passed down from the covered entity to another party. Think of PHI as a stream of information that passes from one person to the next. The protections that HIPAA provide are attached to the information and flow with the information. Anyone who has access to that stream of information must comply with the HIPAA restrictions. Let's look at an example. When Medicaid provides First Transit PHI about riders, First Transit becomes obligated to follow the HIPAA regulations. And when First Transit passes that information to you, the HIPAA protections are attached to that information. Now you're obligated to follow the HIPAA rules. When a party gets PHI from a covered entity, HIPAA designates the new party as a business associate. Transportation providers, lawyers, accountants, translation services, and even janitorial companies may all be business associates. Business associates are directly and separately liable for complying with HIPAA. Since HIPAA obligations follow the PHI wherever it goes, now's a good time to find out what exactly is protected health information, and where will you run into it during your day? Protected health information is any information that comes from a covered entity or business associate, identifies an individual, and is at all related to the individual's health, condition, health care, or payment for health care. Any information you receive about a rider from First Transit may be PHI. Here are some examples of PHI. A rider's name, address, Medicaid number or other identification number, contact information, date of birth or social security number, destination information. For example, the rider may be going to or coming from a doctor's office, or billing information and any notes or details about the rider's condition. All of this information must be kept private and secure. What are the rules you need to follow? Under HIPAA, there are 3 main rules: the privacy rule, the security rule, and the breach notification rule. The privacy rule protects an individual's health information by limiting the ways PHI can be used within a company and disclosed to others. Basically, this part of HIPAA is all about keeping information private. There are rules on when you can access and share PHI. The security rule protects the confidentiality, integrity, and availability of electronic PHI. The security rule sets forth specific safeguards to deal with the risks of the electronic age. These rules include policy requirements, technical protections, and even physical security safeguards. Finally, we have the breach notification rule. The breach notification rule defines a HIPAA breach and may require notifications to individuals, the government, or even news outlets in the event of a breach. This part of HIPAA deals with what to do when things go wrong. HIPAA regulations are intricate and detailed, so where do you start? As a partner with First Transit, we're providing this training to try to simplify the rules, regulations, and privacy expectations. When working with First Transit, you're expected to follow the money rule. Treat all riders' information like it was your own money. Don't just give it away. Don't give someone more than they need, and don't leave it lying around. Let's take a closer look at each of those rules. The first part of the money rule is don't just give it away. Treat information like it's money. Generally, you may not use or disclose rider information without a specific purpose. Use includes access, viewing, or analyzing the information. And disclosure means to allow anyone outside of your company to access the information. This includes transferring information, sharing information, releasing, or even allowing others to view the information. Of course, there are times when you may use or disclose PHI. Those fall into 3 categories: treatment, payment, or operations. You can use PHI for treatment, which means the provision, coordination, or management of healthcare or health-related services. For example, if you need the rider's information in order to take them to their medical appointment or to coordinate their ride to their appointment, you may use their information. You may also use PHI for payment activities. These are activities to determine coverage or eligibility or ensure payment or reimbursement of claims. For example, submitting bills to First Transit in order to get paid for taking a rider to a medical appointment is an example of a payment use and is allowed. Before you use or disclose a rider's information for anything other than treatment or payment, contact your First Transit manager or the First Transit's HIPAA compliance officer. This includes requests for information based on a written authorization you may receive from the rider, a court order, law enforcement investigation, or other investigation or audit. Be sure to contact First Transit immediately if these situations arise. Even when a use is permissible, there are still limitations, and that brings us back to the second part of the money rule. You don't give someone more than they need. For nearly all uses or disclosures, HIPAA requires an adherence to the minimum necessary standard. That means you can only use the amount of information that's actually necessary in order to accomplish the treatment or payment. First Transit uses the need-to-know rule, and you should too. Only those who need to know the information in order to perform their job properly should have access to riders' information. Managers, dispatchers, and drivers are likely to have different levels of access to riders' information. This includes access to IT systems. Remember, convenience or curiosity is not a reason to have access. And if you attempt to gain unauthorized access of riders' information, you may be subject to disciplinary action up to and including termination. On to the last part of the money rule. When it comes to money or riders' information, you don't leave it lying around. Remember, security starts with you. Did you know that you can be personally fined or subject to criminal prosecutions for violating HIPAA regulations? Fines, penalties, and jail sentences aren't just for corporations and executives. For instance, a disgruntled employee at the UCLA Medical School was recently prosecuted for violating HIPAA when he accessed private medical records. He was sentenced to 4 years in prison. Potential penalties for HIPAA violations can also be staggering. These can be up to $50,000 per violation. Plus, each individual could be a separate violation. For example, if you breached 100 riders' PHI, it could mean over $1 million in fines. Beyond fines and criminal prosecution, you could also receive disciplinary action from First Transit or your employer, including exclusion from working with First Transit or termination with your contract for not following HIPAA regulations or First Transit's privacy and security expectations. Since you're responsible for protecting riders' information, here are some tips to help you. You need to take steps to make sure you're not careless with riders' information or with access to that information. If you're logging into any system with rider information, you should have a unique user identification and password. Sharing IDs or general logins are not permitted. And remember, you're responsible for the activities on your account, and your access might be monitored. Do not share your user ID or password, and never write down your password on or near your computer, workstation, tablet, or phone. Remember, just like money, rider information should never just be left lying around. Keep papers in folders and turn them upside down when they're not in use, or use a cover sheet to block the information. Paper records with rider information should be kept in locked cabinets or locked rooms with access limited. These areas and file cabinets should be marked clearly as authorized personnel only. Workstation and vehicles should be cleared of all rider information at the end of every workday, and never just toss that information into the garbage. Shred them or place them in a locked disposal container. You should also beware of your conversations. Keep in mind that you never know who's listening. Be professional, keep your voice down, and be mindful of those around you. Also, a word about social media. Never disclose work-related sensitive information through social media such as Facebook, Twitter, or Instagram. First Transit's policies prohibit you from sharing any customer information acquired through your work on any social media. This includes information you think is public. Even if you've taken out names, locations, and dates, the information still might be identifiable to others. You should also take steps to protect rider information during phone calls and radio traffic. For phone calls, always check the number prior to calling and ask to speak directly to the individual. Never leave detailed medical information with another individual or in a message. The same goes for radio transmission. Limit the amount of details as much as practical. In the office, be mindful of faxes. Always double-check fax numbers prior to sending and use the HIPAA fax cover sheet. A sample is available under the Healthcare Provider Resource tab at www.firsttransit.com. Regularly validate pre-programmed numbers on your fax machine and make sure that you're not sending any information unless the recipient has a legitimate need to know. Let's talk about email. First, avoid sending emails with PHI. If it's absolutely necessary to send PHI in an email, you must use secure email. Double-check the email address to make sure it's correct, and include a disclaimer at the beginning of the email so that the recipient knows the information is confidential. A sample disclosure is available under the Healthcare Provider Resource tab at firsttransit.com. What about your computers, workstations, and tablets? They may contain a lot of protected health information. Here are some practical ways to safeguard them. Log off or lock your PC when you leave it. Shield your paperwork from others and put it away when you're not around. Portable devices such as laptops or flash drives must be encrypted if they have access to writers' PHI. And when you dispose or donate out-of-date systems, you can't simply throw them away. Hard drives must be fully wiped. This includes PCs, flash drives, and hard drives found within printers and scanners. Keep in mind that tablets, phones, and other smart devices may also contain ePHI. When implementing safeguards to protect writers' information, be mindful of situations where the information flows to those outside of your company. Take a minute to think about your business partners. The following may have access to writers' protected health information because of the service they provide to your company. If so, they'll need to sign special contractual confidentiality requirements. Cloud-based software vendors, overflow transportation providers, janitorial or maintenance staff, IT support, document archiving or destruction services, temporary staffing agencies, and translation services. First Transit realizes that accidents may happen. So what do you do when things go wrong? First, report the situation immediately to your First Transit manager or to the First Transit HIPAA compliance officer. You are required to report both breaches and security incidents to First Transit. A HIPAA breach is the unauthorized acquisition, access, use, or disclosure of PHI which compromises the security or privacy of the information. All business associates must report breaches to their covered entities. The covered entity will then notify the individual that their information was breached and will also notify the Department of Health and Human Services. In some situations, local news or media outlets may also be notified. Let's take a look at some recent examples of breaches. Theft of an unencrypted laptop, loss of an unencrypted backup flash drive, snooping employees checking records of friends, family members, or celebrities, unshredded papers with PHI thrown out in regular trash bins, leased printers returned without first having their hard drives wiped, and firewalls left open, making records accessible to public access. These are all examples of potential breach situations and would require you to notify First Transit immediately. In addition to potential breach situations, you must also report to First Transit any security incidents. A security incident is any suspected or successful attempt that could compromise the security of a system, a network, or electronic version of our rider's information. Here are some examples of reportable occurrences. Mailing mishaps. For example, letters, emails, or faxes sent to the wrong address. Missing files or paperwork containing PHI. Missing or stolen computers or flash drives. Malware or viruses on systems, or compromised passwords to systems with ePHI. If you believe any of these situations have occurred, you must immediately notify First Transit's management or First Transit's HIPAA compliance officer. First Transit's HIPAA compliance officer is Jessica Highlander, and she can be reached at jessica.highlander@firstgroup.com. Alternatively, you can make a report using FGA's hotline, 1-877-3-CALL-FG, or by emailing us at hotline@firstgroup.com. That brings us to the end of First Transit's HIPAA awareness, privacy, and security training. Thank you so much for your time and attention. If you'd like additional information about HIPAA, check out these resources.